Alright, Dr. Tim Nickel here at Maximize Chiropractic. Today we're going to talk about auto accidents and how in corrective chiropractic care we view your spine's health differently than at the emergency room that you may be taken to after your auto accident. In this segment, a young female in her mid-20s was involved in an auto accident and was later in that day taken to the emergency room to have an evaluation. She knew that the auto accident was large enough to cause some pain, and the doctors at the emergency room were doing exactly what they were trained to. They took an x-ray of the pain area, only the pain area, meaning that they didn't take x-rays of the other sections because they focus on pain. So their goal was to rule out broken bones and to make sure that there were not any internal concerns caused by the accident. In the hospital, they told this female that everything looked great. And like most of the time, or all the time, you never see the x-ray, you never read the report, you just take a complete stranger's advice. For her good faith, she then still had pain, and she didn't like the medication that they had given her, so she sought out chiropractic care. In my office, the first thing that I do is also review x-rays and then take some x-rays. And when somebody says that their spine is normal, I assume that from the front of the spine it's perfectly straight, and that is pretty obvious to tell a spine that's straight and not straight. If we look at this x-ray, this is what both the emergency room doctor, or let me take that back. The emergency room doctor did not see this x-ray. The emergency room doctor saw a report, and the report was generated by a radiologist. So you and I on the TV can tell obviously this is not straight from the front. Now, was this caused by the accident? Absolutely not. This was there before the accident. It was not reviewed to the patient that she had scoliosis. It was fortunate that she had no broken bones. However, to get to the true reason for this video is to show that there may be something very obvious on an x-ray that would obviously need to be fixed. However, when you go to a medical facility, your doctor or the emergency room doctor is generally not looking at the images themselves. They put their best faith in somebody who reads x-rays every day. And on that report, they may not indicate something like scoliosis, as their scoliosis diagnosis is much more, hey, you need some surgery. There's no pill or potion for scoliosis. And if you go to somebody in an emergency room setting after an auto accident, you are basically asking, make sure there's nothing medically wrong with me that needs surgical attention. So when I look at this as a chiropractor, it drives me absolutely crazy because it is never indicated you have no broken bones, but oh my gosh, you've got major scoliosis, make sure you go see a spine specialist. When you look at this after an auto accident, make sure that you get x-rays and make sure that they are full spine to make sure that the problem is not elsewhere where there's no pain. And in the event that you see something with your own eyes, don't just trust the report. Every time you have x-rays or imaging or blood tests, make sure you get the report, and you can go onto the internet and you can Google what it is that they have indicated on there, and you can do some research yourself. All too often we put our health in the hands of our doctors. We have no responsibility, no sort of insight on what's going on with us, and that's something that can cause some problems. After this is seen, this problem can be improved, but it can never be corrected. Unfortunately, it's too far off to see structural correction, but it can be stopped and minimized. After an auto accident, make sure you see a chiropractor, and if you have the ability in your town, make sure it's a corrective care chiropractor who emphasizes on correcting the spine.